and good evening. I'm Melisa Idris. Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. It's been weeks of devastating fighting in Sudan, which has prompted the United Nations humanitarian coordinator in the country to warn that the conflict could turn Sudan's humanitarian crisis into a full-blown catastrophe. So joining me on the show now, I have Paul McPhun. He's Director for Southeast Asia and the Pacific at Doctors Without Borders or Médecins Sans Frontières, MSF. They have been working in Sudan since 1979, providing medical response to the various emergencies in Sudan, including the Darfur crisis, the South Sudanese refugee crisis, and also the COVID-19 pandemic. Paul, thank you so much for joining me on this show today. I appreciate your time. I'm hoping we could begin our conversation today by learning a little bit about the situation in Sudan before the most recent fighting broke out between the military government and the paramilitary groups there. Can you tell us a little bit about the situation before the recent fighting and how it has evolved over the years? As we understand it, Sudan has been beset by decades of conflict and instability.
Yeah, absolutely. Thanks, Melissa. That's a great place to start. I mean, Sudan has had periodic periods of instability. It was for decades fighting a war against what was then South Sudan. And it's been massively struggling since 2021 following the military coup, with the impact of the international community essentially freezing its support to Sudan as it went through this period of political instability. So it's been struggling with a lack of international aid, a lack of support, sanctions, and an economic crisis. And that's really crippled many of the systems and services within the country, and particularly of note, the healthcare system. So it's been suffering a brain drain. Medical professionals have been trying to leave the country for several years now. They've been really struggling to maintain adequate quality of services, supply, etc. So this eruption of violence, the system itself, the healthcare system, and the country in general was already struggling the worst humanitarian crisis it had faced in a decade. So with everything unfolding now, it's unfolding on top of what was already a very, very critical situation.
Right. So what is the current situation now? How has the most recent violence impacted the population in Sudan?
Well, there's no other word for it except the impact has been quite catastrophic. I mean, the violence is ongoing. Now we're talking about gunfire, shelling, airstrikes. It's obliterated many of the possibilities to move around freely within the country. Khartoum is impossible for us to access. Currently, it's just too insecure. As you know, over 800,000 people have fled out of Sudan across borders. There's currently over 300,000 people internally displaced, and the majority of those are from the Darfur states. Hospitals have essentially closed down and collapsed. It's too insecure for healthcare workers to get to those facilities. Many of those facilities, including some of our own, have been raided and looted by armed gangs. Large parts of Darfur are now essentially lawless. So people are either fleeing on the move, fearing their safety, or they're hibernating, bunkered down, trying to wait for things to resolve, trying to find a period of security or renewed stability so that they can consider their options. It's catastrophic.
Paul, maybe help us understand the work that MSF has been doing in Sudan before the recent violence broke out. How many staff do you have there? Where are you? Sudan is so geographically diverse. Where exactly are those pockets of work that MSF is in?
Yeah, so MSF has obviously been working, as you said, in Sudan and South Sudan now for decades. And we've had large programs across. Indeed, in Khartoum, we work also with internally displaced populations. We work right across the different areas of Darfur, the different provinces, North Darfur, South Darfur, West, Central Darfur. We work across East Sudan, Blue Nile State, Gedaref, Kassala. It's quite a broad spread when we talk about Sudan itself, with a wide range of programs addressing women's health, children's health, pediatrics, nutrition, neonatal care, infectious disease, outbreaks of disease and emergencies, emergency response on a seasonal annual basis. So pretty much the full remit, including supporting with the management of complicated disease burdens, etc.
Okay, and you mentioned a little bit earlier that some of the MSF supported hospitals in Sudan have been looted or raided. That there's concerns of keeping your staff, your patients safe during periods of violence. What are some of the strategies that Doctors Without Borders uses to ensure that there is some measures of security or safety?
Sure. I mean, you're right. Unfortunately, we've been directly targeted ourselves in South Darfur and Nyala. Our compound and our warehouse were attacked by armed groups, and they literally took everything. So they've completely closed down. In West Darfur, in El Geneina, we were supporting a teaching hospital, and that's just recently been raided. It's forcing, the few remaining essential hospitals to simply close their doors because it's too insecure to try and maintain and keep them open. So, we can't operate under those conditions. Nobody can, of course. So we have to hibernate ourselves, bunkerize our teams if we can't get them out. As and when there's been windows with some stability, we've been trying to relocate our teams out of some of the hotspots, for example, Khartoum, and relocate them to areas where we think we can operate with some negotiated security. And that's how we do it. We negotiate with everybody on the ground, and we've been there a long time. The various parties in the conflict currently, we try and keep the communication constantly open so we know what's going on. We try and maintain very much our independence as an organization, our civilian character. We don't use armed guards. We don't associate with armed forces. It's our very medical identity that is our protection. Everybody needs medical care, even in times of conflict. And so we really try and work with all those parties to ensure that they respect medical facilities, medical staff, and patients.
Right. Okay. So for medical staff or Doctors Without Borders staff who are trying to get to patients, get to hospitals, are they provided safe passage? I'm just wondering whether the kind of negotiated ceasefires between the conflicting groups do they apply to those providing humanitarian and medical assistance?
I mean, generally, in less volatile times, yes. I mean, there's an understanding and respect and negotiated access, and if not guarantees, at least assurances offered around, how we can operate, what's expected from all parties, et cetera, et cetera. So there's a whole bunch of kind of, rules and regulations we try and all adhere to. But now it's too volatile, it's too unpredictable. There's too many people running around with guns. As I said, it's become quite lawless. Then it becomes a lot harder to get those kinds of assurances. And that means, for periods, you have to simply stop, cease activities and go into kind of hibernation or relocate your teams to safer locations and then try and renegotiate terms and conditions to go back, as and when it becomes stable again. So right now it's very, very volatile. So it's much higher risk. Not just for us, but primarily for those people desperately in need of healthcare who are trying to move around and get that healthcare.
And so what does that mean for those people who do need access to healthcare and medicine? What do you see as the most urgent medical priorities for the people exposed to the conflict in Sudan?
Well, right now, one example, we're very active in Al Fasher in North Darfur. There's only one remaining hospital still open, and we're supporting that. It was actually a maternity clinic, so it was never designed to manage mass casualties, but we've turned it into a mass casualty hospital with local staff there. We've had over 400 casualties arrive at that hospital. Sadly, 55, probably more now, civilian-related, conflict-related deaths. And these are civilians that are coming in with having been hit with sporadic gunfire. They have injuries such as fractures from gunshot wounds. They have shrapnel in their legs, in their abdomens, in their chests. This is really quite difficult and complicated treatment and triage and surgery that's required. You need blood available, you need surgeons available, anesthetists available, you need drugs available. And all of these things are in very, very short supply. So for people trying to get there, the facilities are simply not there. And when the facilities are there, even ours, even this facility we're supporting, we're really struggling to replenish the supply because there's no safe way to move around at the moment.
So can I just follow up on that? What is the plan for supplies if resources and supplies are running low? Can medical aid, can humanitarian aid come into the country, and will it reach the people who need it the most?
Yeah, that's a huge an important question, and one we don't exactly have an answer to. But yeah, essentially, there are many different airports and airstrips in Sudan. Sadly, most of them have been overrun by the conflict, so they're no longer operational. But many of them could be operational again quite easily if there was some guarantees that safety of passage could be guaranteed for humanitarian supplies to come in. So it just requires those kinds of guarantees, and that's what the ceasefire has been trying to negotiate right now. But there are many smaller airstrips where you could get supplies in to regions that desperately need it. We also have supply. We have supply in various pharmacies, but we can't get to them safely and we can't transport them safely. So again, having some kind of guarantees locally that we could move around without being directly targeted, these are the kinds of things that we're trying to negotiate. This is what we need. We have international teams, experienced international teams trained in managing these kinds of emergencies. We have surgeons, anesthetists, etc., all on standby. And we have supply, emergency kits, surgical kits ready to go. This is the big frustration, is how to actually mobilize given this ongoing insecurity and instability.
Right, okay. We're going to take a very quick break here and consider this, but we'll come back and continue this very important conversation about the situation in Sudan in just a couple of minutes. Stay tuned to consider this. Hi, welcome back to Consider This. I'm Melisa Idris. Let's continue our conversation with Paul McPhun. He's the Director for Southeast Asia and the Pacific for Doctors Without Borders. We're discussing the current situation in Sudan, which has been exacerbated by the recent fighting that has broken out between military groups there. Paul, can I ask you to pick up on where we were talking about a bit earlier with the need to negotiate a ceasefire, with the need to bring in some of the medical supplies to replenish hospitals and provide medical attention to the population that's been affected. What is the role, or how can the international community help in providing some of these avenues to make the MSF's work a little bit easier in Sudan?
Yeah, it's clearly all conflicts ultimately depend on political solutions, and that's above and beyond what we can hope for ourselves or necessarily influence. But part of the international call has to be not just about a 3-day ceasefire with the opportunity to get people evacuated out of Sudan or to get supply in. We need there to be a clear understanding, a clear agreement across all conflicting parties. Just basic things that currently, the safety of medical personnel and healthcare facilities, the existing healthcare facilities, has to be respected. There are facilities there are people there. We can't do our jobs because their safety and security and that of the patients is not being respected. Then we need safe passage for things like ambulances. We need safe passage for civilians. People need to be able to travel to get to the hospitals. So some of these things don't depend on ceasefires. This should be the standard respect of international humanitarian or the basic rules of warfare during conflicts that allow at least the impact to be spared for civilian populations as much as possible. And then we need some better guarantees around humanitarian assistance, access, as I said, to just move supply, to get things to where it's needed. So some of these basic calls to action, if you like, this is what we need to see, there to be some general agreement. It's in everybody's interest, including those fighting parties, that these things are in place, because everybody's going to need that access to healthcare, civilian or otherwise. So ensuring, that healthcare facilities, clinics, warehouses, ambulances, and staff are protected and respected. That's the one major call we have for the international community to put their political weight behind.
Do you think that they're aware of the struggles, the challenges, what's happening, the current situation? Is the world essentially paying attention to what's happening in Sudan?
Well, I think the catastrophic proportions of what's happening, I think, are becoming clearer and clearer to people now. These last few weeks, the reports that have come out of Sudan have been quite horrific. I think people are starting to pay more and more attention. Now, of course, there's a greater risk of this conflict spilling over across borders, creating a huge regional tension. Of course, people on the move. Those people on the move will be heading for safety and security, seeking safe passage to other countries, including heading towards Europe. I think it will draw and garner huge international attention. Already we're seeing the big players, US, Europe, and others moving, key assets into the region, etc. I think there's a general understanding, perhaps less so with the everyday person, and there's so much going on currently. There are many different things grabbing everybody's attention. Personally, I spent years working in Sudan since the 90s. I think trying to keep people's interest alive in these kinds of contexts and emergencies is never easy. The work that you're doing and your colleagues are doing to try convey that message to the general public is hugely important right now, because the people in Sudan are those that are really struggling, those that are really suffering.
So you mentioned, amid all the insecurity and the violence and the lack of safety, what keeps the staff at Doctors Without Borders there? Even though you're bunkered down and waiting for the violence to subside, why haven't you left? As we've seen many of the expat community, the international community has opted to leave the country as the fighting broke out.
Yeah, I mean, it's quite simply our mandate. Now, we volunteer to work overseas, to try and address times of crisis just like this. Yes, it becomes high risk. We have to do everything we can to try and minimize that risk for our patients and for our staff, and we're trying to do that. But for the people on the ground, seeing the impact this is having on the Sudanese population, on the patients they were treating, on the facilities that they're working in, they want to be able to be part of this immediate response. The idea of leaving right now when the needs are so acute and so great. I mean, in Al Fasher, we're treating people literally in the corridors, on the floors of those wards. We have multiple people in beds together. How can you leave a situation like that? I mean, the population desperately needs support, and our medical colleagues in Sudan are doing everything they can. They're the ones that are really on the front line here. We are part of that medical community, and we have to try and find ways to stand with them and support them in this difficult time. But yes, as you said, it's a balance. We need to offer everyone who's not comfortable with that the opportunity to get out of the country also if they can. But yeah, our role is to try and find ways to stay and do what we can in times of crisis like this.
Before the most recent violence, MSF has been in Sudan for 4 decades. Can you speak a little bit about some of the successes and the impacts that you've had in some of the interventions or the providing healthcare to the population of Sudan? I guess I'm wondering, beyond this period of violence, what is the long-term goal for providing access to healthcare for the population in Sudan?
Well, we've worked closely with our medical colleagues in the Ministry of Health and other private healthcare providers, etc., for a long time. And then in many remote parts of Sudan where there's just no infrastructure at all, and the impact you have on a daily basis is phenomenal. I mean, the fact that you can have essential life-saving medical services that otherwise wouldn't be there, or you can complement the services that are there and try and help improve the quality. It's the impact you see on a daily basis and the number of people you can treat. Sudan suffers from seasonal periodic outbreaks of infectious disease, from malnutrition, and we have high volume turnover in our clinics. People depend on that seasonal access to emergency care. So there's no questioning the impact that we've been able to have over time. We've also been able to work closely on things like more complicated morbidities like TB and HIV, help improve treatment options, approaches, access to affordable medicines. So there's many different ways that we've tried to work with our health colleagues to sort of improve the delivery of healthcare more generally. And then, when there are conflicts, when there's internal displacement, people on the move, outbreaks and violent episodes, we've been able to provide everything from shelter, water, sanitation, essential medical services. The fact that it continues to go on and on, of course, it's fatiguing, but it never becomes any less essential to be there.
Right. Well, in the couple of minutes that we have left, Paul, is there anything else you'd like to add about the situation in Sudan that you'd like us to understand, those of us watching tonight? And how can individuals and communities support the work of Doctors Without Borders, support the affected populations of Sudan?
Well, the bottom line is we depend 98% on the support of individuals. People off the street who choose to support the work we do. That's the way we can be entirely independent of government funding, government agendas, and we can mobilize things quickly. We can give doctors the decision making to decide what we do, where and when and how. So we depend on the support of people like you and me. And if anybody wants to support us, they can find out how to do that on our website, which is doctorswithoutborders-apac.org. And that's going to help us stay operational in countries like Sudan and elsewhere. People can take an interest, and that's exactly what you're trying to do here: generate that awareness, get people's attention. This is catastrophic for the Sudanese. Our hearts go out to all of the Sudanese suffering in this critical time right now. Also, our patients and our colleagues, other healthcare providers. So paying attention to what's going on, speaking about it, trying to make sure that this, it doesn't become another one of those forgotten crises in a few weeks. It makes the work that you're doing so essential, I think. That would be my other call to action.
Paul, thank you so much for speaking with me. I appreciate your time. That was Paul McPhun of Doctors Without Borders, wrapping up this episode of Consider This. I'm Melisa Idris, signing off for the evening. Thank you so much for watching, and good night.